Can I ask a question of Megan?
Yes, absolutely.
While we're waiting for them to scroll up.
Yes.
That was, wow, powerful presentation, really appreciated it. I was just curious what the jurisdiction is for the bishop in the diocese over the Catholic healthcare systems, and when they say they're maintaining Catholic identity, does the bishop have any ability to influence that?
Yeah, so I'll speak to my experience as well as my understanding of this. My understanding is that the bishop has to confer Catholic identity at a certain kind of intervals, and I don't recall if that's yearly or every couple years. But I did alert the diocese. I primarily interacted with the, oh gosh, what's the role? The chancellor of the diocese. I was denied any meetings with our archbishop, but I spoke with the chancellor multiple times. They expressed their condolences that I was suffering, but there was nothing, to my knowledge, that came from that. I explicitly asked, again, I think this was maybe 2 years after I was fired, when they last conferred the Catholic identity, and was declined to give an answer. So my understanding is that it is, they have continued to confer the Catholic identity on the health system.
Thank you.
While that's coming up, does anybody have any questions that they're brave enough to just ask out, and I will go ahead and repeat them? Yes.
So how do you navigate being part of professional organizations that have perspectives contradictory to Catholic?
So the question was, how do you navigate being parts of professional organizations that have beliefs that are contrary?
I'd like to take one stab at that. I'm sure we can get other thoughts here. Get involved and become involved in leadership. So I found in the past, for example, I'd taken a very passive role with our state's medical association, North Dakota Medical Association. And in recent years, some people who are very, in the past, they were very neutral on issues of abortion. They sort of avoided it. And then leadership in that organization shifted to where there were some people that were much more amenable to it. And when we had some controversial bills come up, state legislators frequently look to the North Dakota Medical Association to see what they represent the doctors, what do they say. And when these people in leadership gave their tacit approval to some things that were antithetical to the Catholic faith, legislators said, well, this is what the doctors have to say. And I found getting involved with the North Dakota Medical Association, as one example, really made avenues to make your voice be heard. And I would say the same thing in the professional societies, American Academy of Pediatrics, American Academy of Family Physicians, and so on, getting involved and getting leadership so you can influence these white papers and policy statements and so on. I don't think we should be abdicating it.
Thank you. Yes, absolutely, Ashley.
Let me make sure this is on. Can you guys hear me? Yeah, I would just say one other thing is first of all, there are alternatives to the traditional organizations. So the Catholic Medical Association, for example, there's an American College of Pediatricians that is kind of the pro-life Christian alternative to the AAP. There's the American Association of Pro-Life OBGYNs. And these are groups which you can choose to be a part of, or you can choose to be in addition to the professional groups. But in general, I agree with Dr. Carson. I think I'm an engagement kind of person, and so I feel like the only way to reform those organizations or to change those organizations is to be a part of them and to be within them, as long as you don't become apathetic and kind of go with the flow. And again, like I said in my talk, science is not a god. These organizations are not deities. You're allowed to question them. You should question them. And where would our church be if Catholics had just retreated only to the monasteries and not stayed in the world to try to influence?
Thank you for that. A question that is coming up on a practical nature, and how do you first bring up religion with a patient?
So I think that maybe pertains to my talk. I think this should be standard part of the social history. So when you're taking a social history, you're asking about their behaviors, you're asking about their support structures. I think it's a very natural thing to ask, do you have a faith tradition? Is that faith tradition important to you? And how do you engage that in your day-to-day life? That FICA tool that I gave, and I think the slides will be available, is a pretty non-threatening set of questions to ask that should be integrated I think, in every comprehensive history and physical exam where you're taking a social history. And then you'd actually be surprised when you start to do that, how many times that opens a door to all kinds of conversations. I'd actually say more often than not, it's led my patients to want to talk more about that.
Could I add one thing to that? I think I always tell my medical students when they walk into any room to be ready to use all of your senses except taste. Okay, so I say that because really when you walk into a room, there are ways, even if you're not comfortable yet, or maybe your institution doesn't have that, the spiritual history, which I agree should be taken at every single visit. But there are other ways which can be spontaneous by using your senses and looking in the room and looking at, I'm a pediatrician, so I look at the parents. Sometimes I see things like a cross that someone's wearing, Our Lady of Guadalupe necklace that they might be wearing, which is an in to talk about something or to say something like, the Lord is so good, or just an expression that or might assume that they believe, and that can be your opening. There are a lot of times where things come to you in a clinical room spontaneously, and you should take advantage of that. And then even if it's not like sort of an explicit prayer, trying to get to how important is this, a sweatshirt that someone's wearing. There is even something I use when I'm talking to kids about brushing their teeth. You guys are gonna think this is crazy, but every well visit, I'm talking to kids about brushing their teeth. And I'm asking them if they brush their teeth twice a day. And of course, most of them say no, or they look sheepish, or the parents look sheepish. And I'm like, you want to get married, don't you? You want some girl to, when you get down on one knee and ask her to marry you, you don't want to smile and have all these black teeth and have them run the other way. Okay, so most of the time, the parent and the kid start laughing. But what's interesting is most of the patients I see, they're single moms, so they're not married. So it's a single parent. But I'm introducing this idea of marriage as normal and getting down on one knee as normal. And really now, I guess the craziest this is, but heterosexuality is normal. But that is kind of an in, and I have never had, it's not a prayer, it's not a spiritual history, but it's a way of starting to introduce your patient to who you are as well, because that can also be an important part of their care, and then introduce some of the norms that we take for granted in our families. Why shouldn't our patients have a right to hear about what's truly good for them as a whole person? Why should that be secret?
Yeah. And I have something quickly to add too. Working now for my Catholic doctor, I do see a lot of religious patients, but I actually have a huge population of my patients who are irreligious and pretty secular, but who somehow know, like, Catholic life-affirming medical care is better, right? And so I have a lot of patients with a lot of suffering that I see, a lot of infertility, recurrent pregnancy loss, miscarriage. And so kind of part of my vernacular is, I'll be keeping you in prayer. I'm so sorry for your loss. And I've partnered with an organization, actually a good friend of mine helped found, called Lily of the Valley Ministry, Catholic ministry. They're amazing. Look them up. They offer free care. They're a prayer ministry. They minister to not just Catholics, but really everyone. But they offer free prayer care packages to couples with infertility, adverse prenatal diagnoses, stillbirth, pregnancy loss. And I regularly ask my patients who are going through bearing some of these crosses, would you be okay if I connect you with Lily of the Valley? They would love to pray for you. And I have had some of my irreligious patients let me know that that was so, so meaningful to them, and they were so grateful. So I think, being willing to go into that place with your patients, and I've just seen folks be surprisingly receptive to that.
Thank you for that. Taking that maybe just a little bit further, people have wondered, what are some ways you have prayed with patients?
I can start. I'll share a couple of anecdotes in different ways. My first year in practice as an infectious disease doctor, one of my colleagues had a primary care practice that we had to cover intermittently. And one day I was covering his practice, which was a lot of general medical patients, and I was seeing a middle-aged woman for follow-up for hypertension and diabetes. And I went into the room. She had a very flat affect. She was staring at the floor, no eye contact, history of depression. And I asked her, hi, how are you doing? I'm Dr. Carson. I'm covering for my partner, Dr. Kind. And without really looking at me, said, I've suffered for depression for 2 decades. My mother committed suicide. My sister committed suicide. I don't want to live anymore. I'm thinking of how I want to end my life. So this is my 15-minute return visit for somebody I've never met before. And I'm fairly new in practice. And I was in the habit of offering to patients that I'll pray for you, or, I'll be praying for you about whatever problem. So one way about praying was I first said to her, like, okay, do you have a psychiatrist? We need to plug you back in, with whoever your mental health provider is. He's on vacation too. I'm not going to see anybody else. I'm not going there. So now I'm trying to remember, okay, how do you commit somebody, and what's that stuff? I haven't done that since, medical school, and all the issues with that, and really struggling. I started to pray, God, help me. I don't know what to do for this woman. So I really first reached out to God. And I think praying for God to help you know with wisdom what's right, what's a good thing to do. And I had a very, very insistent sort of message in my head, like, ask her if you can pray with her now. And I'd not done that with patients before. I was not comfortable. I'm a Catholic. Like, we don't do that sort of thing, spontaneous prayer out loud. So I asked her if she had any faith tradition, and she said she was Catholic but lapsed, hadn't been to church in many years, did believe in God. And so I sort of awkwardly asked her, would it be okay if I pray with you? And then she made eye contact with me and said, yeah. And I put my hand on her shoulder and I fumbled through some bad, awkward Catholic spontaneous prayer. And she just started crying and crying and crying. And she said, I don't want to end my life. She said, I've been away from God. I know that's what I need to do. I know that's what's been lacking. And so I wasn't quite comfortable with the idea of letting her go, but we talked about that some more. I kind of got her to promise me she had no further plans, that she'd call me immediately if she was having suicidal thoughts again. And I asked her if it would be okay if I connected her with my pastor, so connecting with a formal, person that could help her with these issues. And she did. I saw her later that week. She was like a different person. She wrote me several times for a year later about how that turned her life. So I think that was the Holy Spirit. That wasn't sort of me, but I think that asking God to help there. I'll share one quick other anecdote, sorry, but this one was a really important one in my own transformation in my practice. I was caring for an AIDS patient who was a woman who'd been a drug addict for all of her life. Her mother was a drug addict, prostitute, entered her into prostitution and heroin use at the age of 15. Just a terrible, terrible life. And she was, my staff would always kind of shudder a little bit when she was on our schedule. She had HIV and hepatitis C, and rough, tough person, tattoos head to toes, piercing head to toe, loud, crude, rough, and always was trying to get drugs off of me. So we were fighting all the time about, like, I'm not giving you drugs, and you're here for your HIV and so on. When I tried to refer her once for dysfunctional uterine bleeding, she said, I'm not going to see anybody. I only want you to take care of it. I'm like, I don't take care of this. I'll say Annie is the paraphrase name here. Thought about that. She said, look, Dr. Carson, I know I make you crazy. I know that I frustrate you and all that, but at least you don't treat me like I'm a piece of garbage. If I go to these other doctors, they're going to look at my chart, and they're going to look at me, and they're going to see a piece of garbage. And it kind of shocked me, because we fought a lot. But I always hugged her at the end of our visits, and I was telling her regularly that I'm praying for you. And over a 14-year span of time, we developed a working relationship with her healthcare. And I, at one point in time, said, is it okay if I have my family pray for you as well? And I said, not your name, not your condition, but pray for you. She said, that'd be fine. And she started asking me at our visits, are you and your family still praying for me? And sometimes I have to remember, I need to be praying for Annie. And then we would, and we did. And over further time, she told me that, hey, Dr. Carson, she had this really rough voice. Hey, Dr. Carson, I got in with a bunch of church ladies in this little town, and I'm not hanging out with my druggy friends anymore, and I thought you'd like that. And I said, I do like that. I said, that's great. A little bit after that, she came to me one day and said to me, I know you're into this religion thing, Dr. Carson. And she said, do you really think there's a God that can forgive everything? And I said, what are you thinking, Angela? And she goes, I've done a lot of bad things, like really bad things. And it's pretty hard for me to believe that there could be a God that can, I get a little choked up when I think about this, but that there could be a God that can forgive anything. And probably one of the most powerful, meaningful interactions I've ever had with a patient was to assure her of that. And I just saw this calm and sort of slight smile sort of descend on her. And I was thinking we'd get her over HIV. We were getting better and better drugs for hepatitis C, but it was about a year after that she died in a car accident. And one of the gratifying things, the last bit about praying for your patients is my family still prays for her. One of the beautiful things I think about Catholic faith is we can pray for the dead. And those are just a couple ways I'd share. I could share more, but I don't want to drag that out too much.
Thank you for sharing that. I want to make sure we're going to end on this question because it's an important one. I feel like I'm cross-examining you on a debate here. Informed consent would say that we provide all patient treatment options, despite personal beliefs. How might you respond to that?
You're the bioethicist. Like I said, I don't have formal training.
All right, well, I actually have thought about this quite a bit. So there's sort of two schools of thought, certainly even within the Catholic and Christian traditions. One is that you're obligated as a physician, yes, to provide, or PA or an NP, to provide all treatment options. Now the question is, what do you consider, what is a true treatment option, and a treatment for what, okay? So the most obvious school of thought is, yes, I can tell a teen that comes into my office that is abortion-minded about all the legal options that are available to her and to her family. But you're also obligated to talk about risks, and you're also obligated to talk about what those actually are. When you hear secular people say, well, you have to tell them about everything, okay? They want you to tell them how great abortion is. Right. So yeah, put me in a room with a teen and I'll tell them exactly I'll tell them all their options and I'll tell them exactly what abortion actually is, but they don't want you to do that. They want you to be silent about the risks of things like contraception and abortion. So on the one hand, I'm okay with talking about all the different legal options available as long as I have the freedom as a practitioner to discuss what is actually true about how that contributes to their wellness or not, or certainly to their unborn baby's wellness. Now, recently, I've been thinking more about the other option, which is I was involved in a court case as a legal expert on this question. The state of Illinois is trying to force crisis pregnancy centers, because they are medical centers, to talk about the benefits of abortion to every patient that comes in there, the benefits of abortion. Now, of course, people that work in crisis pregnancy centers would never say that there's a benefit to abortion, but what the state of Illinois is arguing is because most of the medical bodies, these professional organizations, say it's okay and say it's good and it's safer than childbirth, you have to tell women that when they come in. So they're forcing speech, compelled speech, about the benefits of abortion. And that got me thinking about, when you think about options, is a practitioner actually obligated to talk about every single option, including benefits that someone else thinks it has? If I have a patient that's having trouble sleeping, I can say, well, you can have better sleep hygiene. You can take melatonin. You can take hydroxyzine. You can smoke marijuana, because unfortunately now that's legal in our state. You can drink alcohol. There are a variety of legal options that are available to people that have sleep problems, but am I obligated as a practitioner to talk about every single one of them, particularly the ones that I believe in my clinical judgment are bad for their overall health and well-being? And I think one of the important things for you all, especially students, is think about that. If you are obligated, or you decide in your conscience, yes, I'm obligated to talk about all legal options, you are also obligated to tell them about what the risks are for those legal options and what you think as a practitioner who cares about them is their best option.
Yeah, we're instructed to use our best medical judgment. We went to school for this. Yeah, so I think that that's important to remember. Yeah, if a patient's going to ask me a question about, like, well, what would, I'm thinking about, treatment for my acne. What do you think about birth control? I'm happy to talk to them about that is a drug that can be used, but then I follow up with, like, have you had your hormones tested? Like, what other symptoms are you experiencing? And oftentimes digging deeper and actually addressing the underlying root cause, it's better medicine, but then you can circumvent some of those, like, less optimal standard of care options for patients. One thing I do want to say is, in my provider script that I would share with patients, I wasn't bringing up my faith at all in it. You can bring, risk, benefit, concerns. You're using your best medical judgment to care for the patient, and if this isn't what you're looking for, you're always welcome to seek a second opinion. They are welcome to pull as many providers as they want on how to best treat their acne, their sleep disorder, whatever. It doesn't even have to be an ethically hot topic.
Mm-hmm. Oh, can I say one quick thing?
Yep.
Don't be lazy as Catholic healthcare practitioners. You always are going to have to do more. Okay, there's a temptation in medicine to give us a pill, fix this, do this. People who prescribe oral contraception or refer for abortion, they actually think they're doing something good. And that's a real temptation. I've done even assisted suicide. Like, you're asking me for something, I'm giving you something, now I feel good, I feel like I've helped you. But the hard work is all the stuff the Catholics are supposed to do, is talking about true consent, true informed consent. When a girl comes in and she's sexually active, do you talk to her about consent? That's the hard, you talked about self-esteem. That's the hard stuff. Don't be lazy, you can't afford to be lazy. And I will just say, can I say one other quick thing? These two, I mean, I'm almost embarrassed by my talk when I hear a story like Megan's and the courage that she showed, because that's the thing that I want you guys to remember about this whole morning is this is visible proof that courage is possible. And her husband, I think Isaac, right? And her husband Isaac, like, this guy's just sitting there smiling, and, you know, he's been such a rock for her. So really, really, just, if nothing else from this morning, with great respect to Paul also. But really, I mean, it's the story that matters. You can talk about theory and you can talk about philosophy, but remember the story of courage, because you will not, that's what's going to give you hope that this is actually possible.
I mean, Ashley, you were kind of okay too. So let's give all three of them a round of applause.